Hello, welcome to COVID-19 General Safety Training. I am your host, Michael Williams, and I am the Environmental Health and Safety Manager for California State University of Dominguez Hills. Today's objectives will cover these 6 topics, which include general information on COVID-19, how to self-screen for signs and symptoms, the importance of not coming to campus if symptoms are present, when to seek medical attention, the importance of hand washing, and the importance of physical distancing on campus and in the community. Coronaviruses are viruses that are zoonotic, meaning they can transfer from animals to humans. Types of animals where this has occurred in the past include bats, cattle, camels, and cats. Some examples in the past of coronaviruses have included SARS, MERS, and pneumonia. Some individuals are more vulnerable to becoming sick, and those are people that are over 65, and for people that at any age have underlying medical conditions. Underlying medical conditions can include those with chronic lung disease, asthma, heart condition, those who are overweight, diabetic, chronic liver or kidney disease. Lastly, those who are immunocompromised are also at higher risk. Self-screening is important to do and should be done daily. Self-screening includes checking for fever, shortness of breath, cough, sore throat, chills, or loss of taste or smell. Make sure you check your temperature regularly. It is also important if you feel that you came in contact with someone who tested positive for COVID-19 or if they are displaying symptoms. There are many symptoms that have been linked to COVID-19, but the most common continue to be fever, cough, fatigue, and shortness of breath. Here is a list of symptoms comparing coronavirus to the common cold and flu. If you end up with any of these symptoms listed in this slide, it is a good idea to contact your doctor and always stay home if you are not feeling well. If you are displaying symptoms or not feeling well, do not come to campus. If you begin to feel unwell while performing a function for the campus, stop what you're doing and go home or seek medical attention. If you are out ill with a fever or symptoms, do not return to campus until at least 3 days have passed without a fever or 10 days have passed since symptoms first occurred. Once you have recovered from COVID-19, please remember that you must continue to always wear a face covering when interacting with others. Stay at least 6 feet apart and wash hands frequently. Also, avoid shared items whenever possible. On the other hand, if symptoms worsen, you should seek immediate medical attention. These signs include trouble breathing, pain or pressure in chest, new confusion, inability to stay awake, or bluish lips or face. To slow the spread of the virus, remember to wash hands, avoid coming within 6 feet of others, cover your mouth and nose with a face covering when around others, always cover coughs and sneezes, and perform temperature checks regularly. Your campus or facility should be providing you with PPE, such as gloves as well as face coverings to help slow the spread of the virus. Be sure to ask your instructor or facility if you are not provided these items. Hand washing helps with infection control. Wash hands often for at least 20 seconds, as this can slow the spread of the virus. There are 5 steps to hand washing the correct way. First, wet your hands with clean running water, turn off the tap and apply soap. Second, lather your hands by rubbing them together with soap. Lather the back of your hands between your fingers and under your nails. Third, scrub your hands for at least 20 seconds. You need a timer, hum the happy birthday song from beginning to end twice. Fourth, rinse your hands well under clean running water. And lastly, dry your hands using a clean towel or air dry. Building protocols for CSUDH buildings. If on campus, do not enter any CSUDH building if you have symptoms of COVID-19. Remember to stay 6 feet apart, cover your face, and frequently wash hands. Visit csudh.edu/alert for additional information. This is the conclusion of COVID-19 safety training. Please look in the links below for the acknowledgement form. Complete and sign the acknowledgement form and send the form to ehs@csudh.edu. This form is also available on the EHS webpage under the section Forms. Thank you for attending COVID-19 safety training. For any additional questions, please email ehs@csudh.edu. EHS can also be reached by calling 310-243-2895. Thank you.